When your pancreas gets inflamed, it cannot do these jobs properly. The digestive enzymes that should help break down food can actually start attacking your pancreas instead. This causes severe pain and serious health problems. There are two main types of pancreatitis. Acute pancreatitis happens suddenly and usually gets better in a few days or weeks. But chronic pancreatitis is different. It develops slowly over many years and gets worse over time. About 20 to 30% of all pancreatitis cases are severe. The good news is that most people with mild acute pancreatitis feel better within a week. The main symptom of pancreatitis is severe pain in your upper belly. This pain often spreads to your back and can be very intense. Some people say it feels like a knife stabbing them. In acute pancreatitis, you might also have nausea, vomiting, fever, and a fast heartbeat. Your skin might turn yellow, which doctors call jaundice. You may feel very sick and weak. Chronic pancreatitis symptoms can be different. You might have constant pain that gets worse after eating. You may lose weight without trying and have oily, smelly stools. Some people with chronic pancreatitis do not have any pain at all until complications develop. If you have severe belly pain that comes on suddenly, you need to see a doctor right away. This is especially important if you also have a fever, vomiting, or trouble breathing. The two most common causes of pancreatitis are gallstones and drinking too much alcohol. Gallstones are small, hard pieces that form in your gallbladder. Sometimes these stones get stuck and block the tubes that carry digestive juices from your pancreas. Alcohol causes about 70% of pancreatitis cases. Drinking 3 to 5 alcoholic drinks every day for 5 or more years can damage your pancreas. But even people who do not drink that much can get pancreatitis from alcohol. Even weak alcohols, but regular use is more likely to cause pancreatitis. Other causes include certain medications, infections, injuries to your belly, high blood fat levels, and genetic problems. Sometimes doctors cannot find the exact cause. Extremely high triglyceride levels, often exceeding 1,000 mg/dL, 11.3 mol/L, can lead to acute inflammation of the pancreas. Some diabetes medications can increase your risk of getting pancreatitis. This is especially true for newer diabetes drugs called GLP-1 agonists and DPP-4 inhibitors. Wait, there is more. But do not forget to hit the like button if you think this video is useful. GLP-1 agonist drugs include Ozempic, Wegovy, Rybelsus, dulaglutide, Trulicity, and liraglutide, Victoza, Saxenda, exenatide, also known as Byetta. Research shows that people taking these medications have about double the risk of being hospitalized for acute pancreatitis. One large research project found that GLP-1 agonists were linked to 70.2% of pancreatitis reports related to diabetes medications. DPP-4 inhibitors include Sitagliptin, which is sold as Januvia. These medications were associated with a 13.2 times higher risk of pancreatitis in one research project. Another research project found that DPP-4 inhibitors increased pancreatitis risk by 24%. Exenatide was linked to 36 reports of acute pancreatitis soon after it was introduced to the market. Researchers found that exenatide increased the risk of pancreatitis by 6 times compared to other diabetes treatments. But the research on this topic is mixed. Some projects show increased risk while others do not. The overall risk is still low. For every 100,000 people taking these medications for 1 year, about 1,073 develop pancreatitis. Other diabetes medications like metformin can also rarely cause pancreatitis. But metformin may actually help people who develop diabetes after pancreatitis. One research project found that metformin reduced death risk by 49% in people with diabetes after pancreatitis. Insulin use after pancreatitis may increase the risk of the condition getting worse. Research shows that people who use insulin after acute pancreatitis have a 70% higher risk of developing recurrent or chronic pancreatitis. Pancreatitis affects a significant number of people worldwide. Research shows that there are about 45 cases of every 100,000 people have chronic pancreatitis. The number of pancreatitis cases is increasing over time. From 1990 to 2021, global pancreatitis cases increased from 1.73 million to 2.75 million, which is a 59% increase. But the good news is that death rates are going down as treatments get better. Men are more likely to get pancreatitis than women. The condition becomes more common as people get older. About 2.65% of people with chronic pancreatitis also develop pancreatic cancer. Treatment for pancreatitis usually requires staying in the hospital. The length of stay depends on how severe the condition is. Some people only need a few days, while others may need several weeks or months. Hospital treatment focuses on several key areas. You will get fluids through an IV to prevent dehydration. Doctors will give you strong pain medications because pancreatitis causes severe pain. You may not be able to eat solid food for several days or weeks to let your pancreas rest. Instead, you might get liquid nutrition through a tube. Some people need oxygen through tubes in their nose. For chronic pancreatitis, treatment includes enzyme supplements to help with digestion. These supplements replace the enzymes your damaged pancreas cannot make. Pain management is very important for chronic pancreatitis. Doctors start with mild pain medications like paracetamol or ibuprofen. If these do not work, stronger opioid medications may be needed. Some people need nerve blocks or even surgery to control severe pain. If pancreatitis causes diabetes, you will need diabetes treatment. This might include insulin or other diabetes medications. About 17% of people develop diabetes within 5 years after acute pancreatitis. Recovery from pancreatitis varies greatly depending on the severity. Most people with mild acute pancreatitis start feeling better within a week. They can usually leave the hospital after a few days. But severe pancreatitis takes much longer to heal. Some people need intensive care and may have a mortality rate ranging from 5 to 35%. Recovery can take weeks or months. Long-term outcomes depend on many factors. About 15% of people develop recurrent acute pancreatitis within 5 years. Another 13% progress to chronic pancreatitis. These complications are more likely in people who continue drinking alcohol. Quality of life can be affected for years after severe pancreatitis. Research shows that quality of life problems are more common in the first 4 years, but tend to improve after that. People whose pancreatitis was caused by alcohol are more likely to have ongoing quality of life issues. For chronic pancreatitis, the 10-year survival rate is about 63.5%. This means that about 1 in 3 people with chronic pancreatitis die within 10 years. More than 1/4 of survivors still need daily opioid pain medications. Diet plays a crucial role in managing pancreatitis and preventing future attacks. The most important change is limiting fat intake. The National Pancreas Foundation recommends that people with chronic pancreatitis eat no more than 50 grams of fat per day. Some people may need to limit fat even more, to between 30 and 50 grams per day. Foods to avoid include fried foods, fatty meats, full-fat dairy products, and high-fat condiments like mayonnaise. You should also avoid foods high in sugar because they can make your pancreas work harder. This includes candy, cookies, soda, and sugary desserts. Good food choices include lean proteins like chicken and fish, whole grains, fruits, and vegetables. Antioxidant-rich foods like dark leafy vegetables, berries, and sweet potatoes may help reduce inflammation. Eating smaller, more frequent meals often works better than 3 large meals. Some people feel better eating 6 small meals per day instead of 3 regular meals. Alcohol avoidance is absolutely critical. If alcohol caused your pancreatitis, you must stop drinking completely. Even small amounts of alcohol can trigger new attacks. People who continue drinking have much worse outcomes. Smoking also increases the risk of pancreatitis complications, including pancreatic cancer. If you smoke, quitting is very important for your health. While you cannot change some risk factors like family history, You can reduce your risk of pancreatitis in several ways. The most important prevention strategy is limiting alcohol consumption. Heavy drinking is one of the top causes of pancreatitis worldwide. Maintaining a healthy weight helps prevent gallstones, which are another major cause. Eating a diet low in saturated fat and cholesterol can also reduce gallstone risk. Managing diabetes properly is important if you have this condition. Work with your doctor to choose diabetes medications that have the lowest risk of causing pancreatitis. Regular monitoring and blood tests can help catch problems early. If you take medications that can cause pancreatitis, know the warning signs. Call your doctor immediately if you develop severe belly pain, nausea, or vomiting. Early treatment can prevent serious complications. Pancreatitis can be life-threatening, so knowing when to get emergency help is crucial. Seek immediate medical care if you have sudden, severe belly pain that spreads to your back. This is especially urgent if you also have fever, vomiting, or trouble breathing. Other warning signs include yellowing of your skin or eyes, very fast heartbeat, and severe weakness. These symptoms can indicate serious complications that need immediate treatment. Do not wait to see if symptoms improve on their own. Severe pancreatitis can quickly become life-threatening. The sooner you get treatment, the better your chances of avoiding serious complications. If you have diabetes and take GLP-1 agonists or DPP-4 inhibitors, be especially alert for pancreatitis symptoms. While the risk is low, these medications do increase your chances of developing this condition. Managing pancreatitis often requires long-term lifestyle changes. Many people need to take enzyme supplements for the rest of their lives to help digest food properly. These medications must be taken with every meal and snack. Pain management can be challenging with chronic pancreatitis. Work closely with your healthcare team to find the right combination of medications and treatments. Some people benefit from seeing pain specialists or getting nerve blocks. Regular follow-up care is essential. You will need blood tests to monitor your pancreas function and check for diabetes. Some people need regular imaging tests to watch for complications. Support groups and counseling can help you cope with the physical and emotional challenges of pancreatitis. Many people find it helpful to connect with others who understand what they are going through. The key to living well with pancreatitis is following your treatment plan, making necessary diet changes, and staying in close contact with your healthcare team. While pancreatitis is a serious condition, many people learn to manage it successfully and maintain a good quality of life. Consult your healthcare professional before changing your medication or lifestyle. Please click the like button and subscribe if you think this video is useful. On the screen, you see an essential video for you. Thanks very much for watching this video. References are in the comments section. See you in the next video.